Here's another common question. My client wants to fly away after having a treatment. I presume it's on a plane. So what's the real dynamic going on here when patients are asking about flying? Is there a risk with changes in air pressure after having a cosmetic injectable treatment? No, there is no risk at all. Some of this does come from, if you have cosmetic surgery, particularly a breast enhancement, you can't fly afterwards because if any air has got into the chest cavity and it expands, you might cause problems with breathing. That's the theory anyway. So I think that kind of infuses what we think about in terms of injectables. But really, there's no risk in terms of being in a plane. What the risk is about being away from your practitioner if something bad happens. And for that reason, if you're doing anything to do with dermal fillers, I recommend a minimum of 48 hours because that gives you the chance to diagnose and treat a vascular occlusion. Other things that might happen when you're on the plane can wait. If you're developing an infection, possibly even a reaction, that can wait until you land. You'll be able to find a doctor that will probably be able to help you. You can probably support your client from afar in those sorts of circumstances. But vascular occlusion is very different. There's a limited period of time. You need to act quickly. And so we say a 48-hour gap between when you have your treatment and when you should be prepared to actually get on a plane where you can't get medical assistance. So that's how I frame it. Toxins very different. I don't think there's anything with Botox that you need to worry about, and you could fly straight away. I don't see that there's any particular risk other than maybe an incredibly tiny chance of anaphylactic reaction, but you're going to know that within an hour. So as long as you're not treating them in the airport terminal, I don't think there's any risk there at all. So I'd leave 48 hours.